What led you to form SVC?
You know, Gary, I wish I could tell you it was some deep entrepreneurial spirit, but really what it was is I had just started to have children and I thought that it was just easier. I needed the flexibility. And so I built my practice around also being a mom. And what was sort of interesting, because back then, you know, I sort of recognized I know I needed flexibility, but also the people that came to work for me needed flexibility as well. And so we did a lot of, you could work at home, you could come into the office. And so, you know, as people are talking about COVID these days and working at home, I was like, wow, I did that, you know, 20 years ago. And that was sort of the concept that we had many years ago, and it worked well. But I think there's many parents across the country where you have two working parents, and families need flexibility. And so that was really the premise. It turned out to be a great decision because it really exposed me to a lot of different things. I was working, before I went into starting my consulting business, I was able to work on the front lines in a public health department and a public hospital. So that's really where rubber hits the road. You're seeing the trials and tribulations that patients are going through, the doctors, the hospitals. But when I went into the consulting realm, we got to work with a lot of different types of clients, whether it was state governments or hospital systems or even an IT company that's struggling to understand regulations in healthcare. So it gave me the opportunity to have more of a bird's eye view of the entire healthcare system and work with from a lot of different perspectives.